Dr. Peters, a postdoctoral research fellow from the School of Public Health at the University of Queensland in Queensland, Australia, discusses her article appearing in the July 2015 issue of Mayo Clinic Proceedings entitled Changes in the Relationships Between Body Mass Index and Health Outcomes Across Middle Age and Older Adulthood.
Changes in the relationships between BMI and health outcomes across mid-age and older adulthood. You might think that we already know that BMI is related to a wide range of health outcomes. So what does this study add? For some time, researchers have been debating about whether these well-known relationships between BMI and health outcomes are different for younger and older adults. As illustrated by the call-outs on this slide, some findings suggest that the shape of the relationships change with age, while findings from others suggest no effect of age. Hence, the question remains, does the shape of the relationship between BMI and health outcomes change with age? If this is indeed the case, then different weight management strategies may be required for middle-aged and older adults. Using data from over 13,000 mid-age and 12,000 older participants in the Australian Longitudinal Study on Women's Health, we examined the association between BMI and incidence of diabetes and hypertension and 3-year mortality. The first surveys were completed in 1996 with 5 follow-up surveys at approximate 3-year intervals. Data from the National Death Registry were used to identify participants who had deceased within 3 years after each survey. Generalized additive models were used to estimate the risk of each of the outcomes for each rounded BMI value. We drew data from these two cohorts to look at these associations in women aged 45 to 50 years, 50 to 55, 55 to 60, 70 to 75, 75 to 80, and 80 to 85 years. So let's have a look at the main findings. At all ages, the associations between BMI and insulin diabetes were curvilinear. With increasing age, the increase in incidence started at lower BMI values, and the slope was steeper, so that by 70 to 80 years, the association seems almost linear. The association between BMI and incident hypertension was slightly curvilinear to age 60, but in women aged 70 to 85, the association was near linear up to a BMI of about 35 and leveled off at higher BMI values. The intercept was markedly higher in the two oldest age groups, suggesting increased incidence with age, irrespective of BMI. In the 45 to 60-year-old women, 3-year mortality rates were slightly higher at lower BMI values, suggesting an L-shaped association. The L-shaped association was more pronounced at ages 70 to 80, while a U-shaped curve was observed in 80 to 85-year-old women. So what do the findings mean? The results show that the shape of the relationship between BMI and health outcomes does indeed change with age. These findings have the following implications for clinical practice and research. First, screening for high blood pressure is particularly relevant for overweight and obese middle-aged women and for all older women irrespective of their BMI. Second, the high mortality risks associated with underweight in older women warrants more attention for unintentional weight loss in this age group. And third, in research, the effects of age should be accounted for when modeling the relationship between BMI and health outcomes.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.